In this video, I want to talk about vitamin C and how vitamin C is an overlooked or underutilized vitamin that a lot of people are missing. So in the old days when sailors went sailing, they had scurvy if they didn't have enough C, and it'll eventually kill you. And today we have a deficiency in vitamin C again, and it comes out in all sorts of different ways in humans. And if in some of the videos that I've linked or included in this video, there's research done where if you look at all animals except primates and humans, all animals produce their own vitamin C, so they don't need to supplement. Where we have to get vitamin C through our food or supplementation, our bodies don't produce it. So if a goat is under stress or illness, it'll produce over 100,000 milligrams a day of vitamin C just out of its own physiology. So when we talk about you need 200 milligrams a day is the daily recommended allowance, it's ludicrous. You need thousands of milligrams a day, up to 40,000 a day if you're sick. So again, it's the medical model we follow have basically no idea about nutrition and what our bodies need. So there's been some research on people who've had the swine flu, who on their death's bed in hospital, who had mega doses of intravenous vitamin C and have been cured instantly almost. So why is the medical establishment stopping us from using intravenous C? That's what I want to ask. And this video covers that topic. So basically snake bite, spider bite, any flu, any virus is cured by vitamin C taken intravenously, and it could be up to 100,000 milligrams. Now, the medical establishment will just never do that. So we have to find our own ways of getting C into our bodies, and the best way is obviously supplementation on a daily basis. Take 2,000 or 3,000 milligrams a day. If that's too much, you might just drop back a bit until you can build up a level where you can take that much. And this video is very good. It's the best medical scientific research on vitamin C. So I hope you like it, and it'll help your family. Thank you for watching.
Welcome, Susan Humphreys.
Thank you, Lou.
The floor is yours.
Thank you. Welcome, and thank you for your warm welcome. It's very nice to be in Sweden and your beautiful city of Stockholm. And talking about vitamin C it's an interest of mine, the vitamin C. Many of you may know that my primary interest is in the topic of vaccination. However, in the study of vaccination, what I have realized along the way is that much of what I learned in my medical education was lacking in details on how to support the biology of the human being. Mostly it was designed to suppress symptoms and to drugs that start with anti. So that tells me a lot. Now these drugs, as you know, they work very well that we can use in allopathic medicine, and when somebody's dying, they can come in very handy. But when people are just a little bit sick, or when they are healthy, as you know, it can be very helpful to support the chemistry of the body using the design that it was designed and the earth products that were put here for us, and not the products necessarily that the drug companies have made for us. So since I've learned to use vitamin C, I found that not only has my own health become extraordinarily better, but my prescription writing has gone down significantly, and the health of my patients has also improved greatly, because vitamin C does so many things from the time that we are conceived, actually, until the time we die. Vitamin C is necessary for so many processes. I heard that many of you are orthomolecular doctors here, yes? Or several? Anybody orthomolecular doctors? Yeah, okay. So I don't have to tell you too much about the benefit of vitamin C, but I hope you will at least learn maybe some more details to fill in the physiology of vitamin C. And I will present to you some of the current research that supports the use of vitamin C even in the sickest patients that are in intensive care units. This just came out this year in 2014. And then in the end, I will take questions, and I will ask that if you can just write your questions down for now, rather than stopping me, unless I say something you don't understand, put your hand up, and we will clarify for you if it's a word, a translation that you need, okay? All right, so there is a lot of mythology in the conventional medical realm that trickles down and moves into society. And this mythology is mythology that I used to believe, and that is that vitamin C is, it's necessary to prevent scurvy, but it isn't really necessary to be given in any higher doses than we get in our food necessarily today. Well, I found this not to be true, not only for my patients and for myself, but the medical literature and some alternative literature really supports that these myths are actually not true. One of the myths that you'll hear often from conventional doctors is that doses over 1,000 milligrams are dangerous and wasteful and just gives you expensive urine. We hear that the body becomes saturated if you take 150 milligrams, so no use taking any more. We hear that kidney stones can be a big problem, and we have to be on the alert not to develop kidney stones. We hear that there is no science behind high ascorbate use, despite the fact that Nobel Prize-winning scientists have shown that there is science and there's ongoing science for the use. We hear often that natural whole vitamin C is always the best thing to be used. Now, food is always the best thing to be used first, but when you're really very sick, you will not get enough vitamin C from your food. Okay, I'm seeing nods. So, and the other thing is that we can get diarrhea from high doses of ascorbate, and we hear that this is dangerous and we can kill little babies and cause bowel necrosis. None of this is true. None of this has ever been proven clinically or scientifically. We also hear that you can get enough from food when you are very ill, and that also is not true. So animals use 4 sequential liver enzymes to convert glucose, it's very simple actually, into another chemical, which has this fancy name right there, and it is called 2-keto-L-gulonolactone. You don't need to know that. But then that shape shifts automatically into L-ascorbic acid, and this is the magic chemical that has so many functions in our body that enhance our health and can be very life-saving in certain situations and can be consumed very rapidly during illness. This enzyme right here, number 4, is missing from human beings and some other animals, some bats, some guinea pigs, and some primates. The gene that codes for it is present in humans, but it just doesn't work. We don't know why. So human beings and these other animals are dependent upon the food source in order to have this life-saving nutrient. So let's take a look now at animals that make their own vitamin C. If we look at a cow will make 18 milligrams per kilogram per day, and they will take in a total of around 12,000 milligrams, plus all that they're getting around here as well, okay? So he's making 12,000, or she, and also eating the grass and the greens, which have more vitamin C. Then we can look at cats. They make their own, 20 to 40 milligrams per kilogram per day, for a total of around 180 milligrams per day intake. Production. Now, mind you, the recommended dietary allowance for me is half of that, about, okay? All right, so now let's look at animals that are dependent upon the environment for vitamin C because they cannot manufacture their own. If we look at a wild gorilla, we'll eat approximately 30 milligrams per kilogram per day for around 4,500 milligrams. If we look at the guinea pig, the classic animal that does not make vitamin C, which I believe is why this makes actually a good lab animal to do research looking for illnesses in humans, is because they also don't make their own vitamin C. And they'll take about 30 milligrams per day, and again, about 33 milligrams per kilogram per day. So it's my belief that this is actually a good place to start in estimating what our baseline requirements are, even as human beings, 30 milligrams per kilogram per day, approximately. Now, this is me on a farm in New Zealand with 2 goats, the baby and the mother, and I found out interesting information about goats, and that is that when goats are healthy, they make 185 milligrams per kilogram per day. And when they are stressed, they can make up to 1,400 milligrams per kilogram per day, for a total of around 100,000 milligrams, okay? And one day the veterinarian came out to the farm to deal with some problems with the other animals, and he volunteered to us that goats hardly ever get sick. And when they do get sick, it's usually something so bad that it kills them. So that is, I think, very interesting anecdotal information. Now, I make none of my own vitamin C, and I am told that I only need 75 milligrams per day, and that's about 1.2 milligram per kilogram per day. So as you can see, there's something very wrong with the estimation that we as human beings need, even when we compare ourselves to animals who make their own and animals who are dependent. It's a gross underestimation of our actual need. Well, there were problems with how these estimates for human beings were made, and I don't really have time to get into that, but briefly, it was done just on a few healthy men and women, very small group, and they looked at the wrong kind of cells in order to make this estimation of what we need. So the science behind this estimate is flawed, and some scientists came along later and said, no, 200 milligrams per day, and the authorities rejected that, even 200, so they still say 75 to 90, for 90 for man, 75 for woman, and if I'm a smoker, they say add 35 milligrams. Well, I'll tell you that one cigarette uses 25 milligrams of vitamin C. So you can see if I'm smoking 10 cigarettes per day, I'm already tapping into my reserves of vitamin C. Okay, so I just want to emphasize that simply preventing scurvy is not the same as promoting optimal health. These levels here that they're telling us is for preventing scurvy, and they're still rather inaccurate, because if one is to develop, say, influenza or whooping cough, those reserves can be depleted very rapidly. Okay, so I looked around to see if anybody studied the levels in the blood of vitamin C in people and what it is. And I found this study from Canada, and they looked at people who were coming in and out of hospital to have their blood drawn. So they might be a little bit sick because they're probably, getting blood tests. But this was what they found, is that 84% they said was normal. This 23% they said subnormal, and only 11.4% they called deficient. Now, what they call normal, I don't call normal, because they're calling greater than 28.4 normal. I believe that 100 to 125 is probably closer to normal, and I'll show you why in a minute. So I think more than this is actually walking around with low levels. But let's look at the difference now in patients who are in hospital and ill. What we find is that there's much more of them that are subnormal, 60% subnormal. 19% are called deficient, which is very, very low level here, 11.4 micromole per liter, and only 21% considered normal by their very low standards. And if we look at this graph at the bottom, it shows that the hospitalized patients are the black bars, and the outpatients are the clear bars. And you can expect some overlap. But what I want to point out is that both of these groups had some people that were up around 100 or 125. And this, in addition to other literature that I have read, and the dynamics of vitamin C in the body, is what leads me to say, I believe this is a better range for us to live in. 100, 125, even 150 is easily possible with repeated, either high diet with this nutrient or with repeated doses of various forms. So this study concluded and said that nearly 1 in 5 had plasma vitamin C concentration consistent with scurvy. And even more disturbing to me was that 24% of these people, when they went into hospital, were taking vitamins, and doctors discontinued most of it when they were admitted to hospital. So I wonder to myself now if conventional doctors even knew about this, if they would do anything about it, because we still are living with this myth that we don't need to look at vitamin C levels in sick people and we don't need to supplement, although that is changing. But there was a doctor, even back as far as 1950s, who had a rather interesting comment to make about his colleagues. This is Dr. Frederick Klenner, who was one of the pioneers of using high doses of ascorbate, and he cured many of the most atrocious diseases in the 1950s, including polio, and this black widow spider bite, which he gives a detailed case history. And in this case history, he says that there are some physicians who would stand by and watch the patient die rather than use this vitamin C, because they're still thinking that it exists only as a vitamin. And it is much more than a vitamin, and I'll tell you more about that in a moment. So there's another interesting study here, because it basically just works with food, with some kiwi fruits. And this is a study from New Zealand, and they got some adult males around 30 years old, healthy, and they wanted to see what the vitamin C levels in the muscle were. So they volunteered for this horrible muscle biopsies, but we got some interesting information. They started by just measuring their levels, their blood levels, and they found that they're pretty much on the low end of normal. 30 to 40 was their range when they started. Then they said, just consume a diet low in vitamin C and stop supplements. And look, it dropped down, within 5 weeks, dropped down almost to levels of scurvy. And then they said to half of them, you take 1/2 of a kiwi fruit per day, and the other half eat 2 kiwi fruits per day, and then we'll see what happens to your levels. And interestingly is that they were able to rise these levels fairly high just with 2 kiwi fruits per day, up to 70. And even the half kiwi fruit had a pretty good effect in the muscle. Okay? Now mind you, different parts of our bodies need different amounts of vitamin C. The adrenal gland and the eye need very high amounts, for instance. Muscle is somewhere in between. So this is just an interesting study that shows you that if we did eat a minimum of 5 fruits and vegetables per day that has vitamin C in it, that most of us could have pretty good levels, assuming they're not sprayed with pesticides and they're fairly fresh and we're not smoking and being exposed to dangerous chemicals. So you can divide the need for vitamin C into 2 categories. And it can be the everyday needs, like detoxifying chemicals like car fumes, like preventing damage from environmental sprays, or from any poison, because vitamin C acts as an electron donor. And what those electrons does is fixes the damage that's done by these oxidative stress. And I'll give you more detail about that in a moment. So that's why vitamin C is called antioxidant. So it can protect people from pollen and allergies, also by acting as an antihistamine. This is very well established in conventional medical literature, that high histamine levels equals usually, almost always, low vitamin C levels. When you give vitamin C, histamine drops. I found clinical practice and evidence in medical literature that in instances where there's allergic reactions and histamine, vitamin C is very, very valuable and does not have the side effects as most conventional antihistamines have. It is also a cofactor for many enzymes, some of them that make collagen, that make neurotransmitters, hormones, and this carnitine molecule, which we need in order to make use of fat that we eat. There are two medical issues that fill most doctors' offices, whether you're alternative medical doctor or conventional medical doctor, and these two medical illnesses filled my office almost exclusively, and those were diabetes and high blood pressure. Okay, and both of them are associated with low vitamin C, and both of them respond to various degrees depending on the person and the dose of vitamin C, but respond well to supplementation. Both types of diabetes are becoming worldwide problems, epidemics, and both of them are largely preventable. And we also know that diabetics have lower vitamin C levels than non-diabetics, about 30% lower. Even if you're a very well-controlled diabetic, diabetes is an inflammatory state. So we find that just about every aspect of glycemic control is improved with supplementation with vitamin C. Okay, heart disease is the other one. Now, heart disease is another problem. It's caused by too much oxidative stress, toxin exposure, toxins both from inside the body and from outside the body. It's an inflammatory state. And when it affects the heart, it's basically one area in the heart that becomes really sick, but it's happening usually in the entire body. And again, every risk factor for heart disease is amenable, meaning improved, by vitamin C. So we know that blood vessel health is improved because blood vessels are like layers of bricks and mortar. And you cannot make that mortar without having adequate amounts of vitamin C. And you can have just an area in your heart that has scurvy, even though your blood levels may be normal. And we know this from biopsies that were done in the 1950s, where they looked at these people who had heart attacks and strokes, that they find parts of the brain and the heart that are extremely low of vitamin C. And they're usually parts that have a lot of stress acting on them. Cholesterol and high blood pressure, all of these things are improved. There's adequate literature for you to look at. The physiology is known about how the vitamin C works. And so really the only thing that there hasn't been a whole lot of research on is exact dose. But when it comes to vitamin C, I believe that most people have to figure out what their own dose is, that it is not the kind of thing that I can say, every person with high blood pressure should take X amount of vitamin C, because we all have different deficiencies and changes throughout time. Here is a book if you want to learn more about the heart aspect and the blood vessel aspect of vitamin C. This is written by a doctor named Thomas Levy. He is a cardiologist, and he is also an attorney. And his viewpoints are very well backed by scientific literature. He has, in this one, I think, over 650 scientific references. And so it's a very valuable book that describes exactly how these changes in the heart and the blood vessels are affected by vitamin C and why.
I'm very pleased to be here. This is my second time in New Zealand, and I'm especially pleased that I can be here on an occasion like this. But let me say at the outset that what happened to Mr. Smith, to most physicians, most laypersons that don't know about vitamin C, truly was a miracle. But I got to tell you, when you've worked with vitamin C for much of your life, especially as a medical professional, it's a wonderful thing, but it's not a miracle. It's just hard science, and it's the result that I would expect to happen the majority of the time with a patient even as far advanced as Mr. Alan Smith was with his swine flu. Next. I don't know how many of you know Mark Twain in the United States, but be careful in reading health books. You may die of a misprint. Next. Now, when I get back to the States next week, I'm going to put this entire presentation on my website, and many of the references that you can see in here you can click on in your computer, and you can go directly to some of the full original articles as well as the abstracts, so you'll have a wealth of information at your fingertips for both yourself and for anybody else that you may know that would be interested. So you'll have a lot of documentation you can work with for your health provider or your family or your friends. Now, also throughout this presentation, when I mention an article, I put the author's name, a number, which is the volume number, and another number, which is the first page number. And if you go to this website, which is called PubMed, and enter in that box the author name, the volume number, the page number, you will go immediately to that abstract or article. So you can see the original source of information. Next. Now, this often occupies an entire lecture, but that's not the thrust of this one. And that is the facts on how vitamin C works. Quite simply, quite elegantly, all infections do their damage with what's called oxidative stress or electron theft, electron robbery. And the laboratory tests show this. All toxins, in the same fashion, cause all their damage by electron theft. Vitamin C, as an antioxidant, its ultimate task is to contribute electrons. And it's really that simple. So if you have something, an electron source, that can go in and immediately replace the electrons that were taken away by your toxins, by your infections, you repair the tissue damage and you prevent more. It's that simple. And this is why, when I first encountered all this information, I already knew that vitamin C, if you gave a large intravenous drip, could neutralize virtually any toxin imaginable. No matter what the toxin was, snakebite, barbiturates, mercury, anything you can think of. And I said, how can one molecule, just from a biochemical point of view, I said, how can one molecule neutralize 100 different diverse molecules? Well, there had to be a final common denominator, and this denominator is electron flow. Whether electrons are taken away or whether electrons are donated is the final common denominator as to whether or not you make somebody better or worse. Next. Now, the facts. Antimicrobial, antiviral. And this again, this connection here will put you with the complete original article. Dr. Frederick Klenner, in 1949, cured 60 out of 60 cases of polio. And it was in the middle of a polio epidemic, so there was little doubt about the diagnosis. But even if a fraction of them were in polio, it's still a cured polio and whatever viral syndrome presented in these infants 100% of the time. Now, even then, if a cynic wants to disregard that and say, well, maybe it's a cold, maybe it was some non-specific virus and the baby just got better, Dr. Klenner reported another case in 1951 where the child already had polio for 2 weeks and had flaccid, that's like dead muscle paralysis in the lower extremities. At that stage of polio, the vitamin C infusions brought a complete cure. It took a little longer than the other polio patients that didn't have any paralysis. They were resolved in 3 to 5 days. This child, because of the paralysis, required a full 2 weeks. Next. Now, one of the more fascinating articles you can run across, because it tells very vividly, in very human terms, the problems that Dr. Klenner encountered in trying to inform his fellow doctors of what he was achieving. And the article that Dr. Landwehr wrote is called The Origin of the 42-Year-Old Stonewall of Vitamin C. And again, you can access this entire article online and see the details of how Dr. Klenner went to the conference of the American Medical Association in Chicago, and he was based in North Carolina, presented his findings that I told you about polio to the entire Congress, and it didn't rouse a question. It didn't rouse a blink. It was a symposium on polio, and the next doctors got on and started talking about the artificial support of the respiration that gets paralyzed in polio patients, and Klenner was forgotten as quickly as he stopped talking. So I've suggested that the title should now read The Origin of the 61-Year-Old Stonewall Vitamin C. Next. Now, we've got a lot to cover that are important points tonight, and I can speak for hours on some of this, so I'm going to go quickly over some things that are very important, but that's why you have these references. You can go straight to them. Go to PubMed, type in Dalton 55, 1151, and you'll see the article or the abstract. Well, in point of fact, vitamin C has and routinely, completely and totally cures acute hepatitis. I say acute, not chronic. Chronic hepatitis is a different bag of worms. The microbe, the virus, is much more difficult to reach with a therapeutic agent, but in acute hepatitis, across the board, vitamin C, given intravenously in adequate doses, will give you a complete clinical resolution of the patient, including normalization of the astronomical liver enzyme test that you see in acute hepatitis in 7 to 10 days. Now, we saw with Mr. Smith, he was in an induced coma, and maybe toward the end of the time period on the ECMO machine, it was probably a real coma. But what I said earlier is his response, while virtually miraculous to someone who didn't know about vitamin C, it's reasonably expected. Dr. Klenner routinely, multiple occasions, took cases of viral encephalitis where the patients had already progressed to a complete coma, and not only cured them, but brought them back to consciousness, usually between 12 and 24 hours after initiating the high-dose vitamin C. Vitamin C is an absolute viricide. That means, in the test tube, if you have virus and you have vitamin C, the virus is dead. Or in the case of virus, it no longer replicates. Vitamin C is an absolute viricide. Next.
The story of a man, a dairy farmer, who came back from the dead. Doctors were all set to turn off his life support, but his family refused to give up. They demanded the hospital try high doses of vitamin C. Well, as Melanie Reid will show you, it turned into a fight. The specialists didn't believe such a treatment would work, but, well, suffice to say, the farmer is no longer on death's door. And his family claim he's living proof.
This is Aotearoa farmer Alan Smith in Auckland's intensive care unit shortly before the doctors told his family his life support should be turned off and he be allowed to die.
And I just sort of backed up and looked at him lying there so helpless, and you know, he was my whole life. We've been together since we were both 16.
On the Smiths' Aotearoa farm, Alan's wife Sonia and son Shane remember when they were told it was all over.
I was, you know, speechless. I mean, it was like, your dad's the sort of person that you could always rely on him to be there to help you, and it was like, shit.
Childhood sweethearts Sonia and Alan were married when they were both 17. They have 3 sons. Their 9th grandchild was on the way when Alan got a severe case of swine flu.
He was always there to help us with anything. And it was just, yeah, I mean, what were we going to do?
And he wasn't very old, eh?
No, only at 56.
But on the other side of the house, over the back paddock, having been taken on an aerial check out of the farm, the bloke they're calling the Miracle Man. Looking anything but dead.
Alan!
Hello.
You're not doing too bad for a guy that was meant to be 6 foot under.
Well, apparently I was supposed to be turned off. About over a year ago now it was. Yes.
They're going to turn the machine off that was keeping you alive?
They were going to turn the machine off. And
Alan Smith's survival has been described as one of the most remarkable and controversial turnarounds in New Zealand medical history.
Feel lucky to be alive?
I am very lucky. They tell me I'm not a 1 in a million, I'm 1 in a billion to live.
Alan's story began on June 28, 2009. He arrived at Auckland International Airport after a fishing trip with mates in Fiji. He caught a connecting flight to Tauranga where his launch is moored and was joined by his wife Sonia.
I woke up in the night and he was really hot, so I gave him some Panadol and that cooled him off, but cooled him off a bit much because later on he was so... I woke up again and he was just like, he was laying there just stone cold and just laying there still as, and I thought, oh God, the first thing came to my mind was, God, he's dead.
In Tauranga Hospital, Alan was swabbed for swine flu. After 2 days, his deterioration was so dramatic, the 3 sons and 8 grandchildren arrived, warned this could be a final goodbye.
Just seeing him just in an induced coma and everything like that just was horrible. I mean, yet that was the beginning.
A specialist crew flew in from Auckland with a portable ECMO machine, a complex life support system which takes over the function of the lungs. All the grandkids had surrounded their papa before he was airlifted north.
And they were still alive. My papa, they said.
Oh, then what happened? They stood waving at him.
They lined the corridor.
Oh, when he was taken out?
When he was taken out the stretcher, yeah. Then I waved goodbye to the helicopter. Yeah.
In the hospital?
Yeah, from the hospital as they took him away.
And you must have been thinking, the chances aren't good.
Yeah, well, yeah, it was then I was starting to think, well, you know, where are we going to go with this?
As Alan lay in a coma in Auckland Hospital, heavily medicated, ECMO and other machines keeping him alive, Sonia began a detailed diary.
Saturday, 4th of July. Told this morning that it's 100% swine flu with no other bacteria. He is worst case in New Zealand and Aussie to be put on an ECMO machine. X-ray chest, whole lungs clouded out.
These are those clouded out X-rays. Alan developed what's known as whiteout pneumonia. This is when the lungs can't be seen by X-ray, so full of infected fluids they are unable to take in any air whatsoever. For weeks on end, Alan's condition changed little, hovering close to death.
When it got to 3 weeks, it was really getting scary then.
Just as the family thought things couldn't get any worse, Alan was diagnosed with hairy cell leukemia. Auckland Hospital notes to the family say,
"The type of leukemia Mr. Smith has is potentially treatable if that's all he had. However, with his lung failure, Mr. Smith cannot survive."
Monday the 20th of July. United States specialist came. Alan's still same. Asked for meeting at 3 p.m. Told us they were going to turn off life support.
While Auckland Hospital refused to take part in this story, 60 Minutes has obtained Alan Smith's medical files and records of that Monday meeting.
This morning we, the CVICU consultants, met and discussed with the ECMO specialist from America, Mr. Smith's situation. The group is in unanimous agreement that Mr. Smith should be removed from ECMO and be allowed to die. Continuing is only prolonging his inevitable death.
My brother just stepped in and he said, no, you haven't tried everything. You've got to try vitamin C, intravenously high doses. And they just said, no.
The family pleaded with doctors that Alan be administered high-dose vitamin C, a treatment right outside of mainstream medicine.
So what was the doctor's reaction?
Oh, they said no, because there's no proof of it doing anything or doing anyone any good. Or my mind was just spinning because they wanted to turn them off, and I'm thinking, well, I hope we can get through this. And with that, Paul and Shane walked in.
That's your sons?
Yes, two of our boys. They walked in, and then, they really stood their ground.
I said to him, mate, I said, if you lie on that bed for as long as he had without vitamin C, you will die too, just like he's going to.
Paul and Shane rang and told me, they sound like giving up. It's like when you got a dead cow down. I said, well,
They've given up.
I said to them, just force this vitamin C in them so it actually happens. And
It'd be fair to say the Smith boys, Paul, Josh and Shane, weren't backwards in coming forward.
I says, what have you got to lose, mate? You give me one good reason what you guys have got to lose by trying it. I says, because it's not fair that we, all of us, should go on living our lives with the thought in the back of our minds, if only we'd pushed and tried harder, would it have saved them?
They were all about to find out if they'd pushed hard enough. The next day, Tuesday, Auckland Hospital arranged another family meeting.
All of intensive care unit medical staff have met again. We are all in agreement that vitamin C will be of no benefit. We all agree Mr. Smith will not survive. However, one member feels slightly uneasy that we should wait a little longer before taking Mr. Smith off ECMO. It's therefore reasonable to wait until Friday. If Mr. Smith has shown no improvement by then, he will be taken off ECMO. In the meantime, given the family's strong beliefs about vitamin C, we are willing to give this over the next 2 days.
So, Tuesday night, he got his first dose of 25 grams through the IV, and Wednesday morning he got another 25 grams. The Wednesday afternoon they did a CT scan on his chest, and that's when they found the air pockets in his lungs, whereas the x-rays had showed just complete white.
So, Alan's x-rays. Before high-dose intravenous vitamin C, so full of infected fluid, the lungs can't be seen. This x-ray taken after 2 days of high-dose vitamin C treatment. The lungs dramatically improved and readily visible. By D-Day, the Friday when Alan Smith was destined to die, when the ECMO life support was to be withdrawn, turned out to be the day Alan Smith was destined to, well, maybe, survive.
Mr. Smith is stable but still critical. He has improved over the last couple of days. Turning Mr. Smith prone has probably made the biggest difference. His chest x-ray is better.
They didn't agree or believe that the vitamin C turned him around, because...
What did they think turned him around?
Coincidentally, the same time as he started getting his vitamin C, they proned him, which was turning him over onto his stomach. So that's their argument on that's why he got better. So my question to that is, why didn't you try that before even suggesting to turn the machine off?
So less than a week after the high-dose vitamin C was started, Alan had improved to the point that he could be taken off ECMO life support.
Sunday 26th July. Got taken off ECMO this morning today, hooray. Seems funny seeing him breathing again. He is taking a few of his breaths on his own.
Then, just as the family felt they could breathe a bit easy themselves, Alan's health started to dive. They would find the vitamin C had been stopped.
This time, a different consultant was there, and he was just so adamant against it. He sat back in his chair and rolled his eyes and crossed his arms and looked at the ceiling and said, "Nah, not putting him back on it. Nah, nah."
Did he make you feel like a bit of an idiot?
He did, and it's the first time everyone had hit someone.
I got quite serious with that doctor.
How serious?
The meeting was stopped, put it that way.
3 days later, the vitamin C was restarted, but only very low doses of 1 gram twice a day.
So we got them all in one mob, not 2 mobs?
Now, while these King Country brothers certainly don't claim to be medical experts, they say the mucking about with the vitamin C was reflected by the changes in their father's health, and they say you'd have to be a bit thick not to see what was going on.
So he was on 100 grams per day, improving rapidly, very rapidly, and then he went downhill rapidly when they stopped it, cold turkey. When he got put back on vitamin C after that heated meeting, it was at a very low dose. And once again he started recovering, but it was a slow recovery. They expected to have him transferred to Waikato in less than a week. It took a lot longer.
By early August, still critical and still in an induced coma, but by now breathing on a ventilator, Alan was airlifted closer to home, to intensive care at Waikato Hospital, who, like Auckland Hospital, wouldn't be interviewed. It was here the Smith family found they had another scrap on their hands.
A doctor comes on and stops it. And
stops the vitamin C?
Stops the vitamin C.
And says what?
And I said, you know, why? And he said, well, this stuff has come down with him and we don't know what it is. So here we go again, another fight.
This time they brought in the heavyweights. Wellington public law specialist May Chen warned Waikato Hospital.
The decision to discontinue the high-dose intravenous vitamin C treatment without consulting with Alan's family is in breach of Right 7 of the Health and Disability Commissioner's Code of...
There was even a threat, wasn't there, that you would go to the High Court?
Yes, we would. Well, this is someone's life we're dealing with, not just anything, you know. Once he's dead, he's dead. You can't get him back. And we weren't going to let that happen.
So they agreed to give him a couple of grams of vitamin C a day.
Yeah.
And you wanted him to be on like 50 grams a day.
That's right. Yeah.
So they kind of said, yes, we'll do it, but didn't really do it anyway.
No, that's right.
Slowly recovered, and it wasn't until we got some oral lipospheric vitamin C into him, and that's when he once again recovered really fast.
After a total of 9 weeks in a coma, Alan eventually was woken, which is when Sonia began administering vitamin C to Alan herself, using a special high-dose oral form known as lipospheric. The next step was meant to be months of rehabilitation.
I was taking 6 grams of that a day, of the lipospheric, and of course when I had to go to rehab again to learn to walk, I was told I'd be there for 3 months. Well, in 3 months I did not like the sound of that, but I walked out of that hospital in 1 day under 14 days, and even the doctors were absolutely disbelieved that I could come right so quick.
Alan was back on the farm recuperating when his neighbour John came down the road calling out to him.
Says to me, "Hey, Smitty, you owe me $15. I said, "What do I owe you $15 for, John?" He said, "I went and got me suit dry cleaned for your funeral, and you bugger, you've come back." Get him behind.
Alan Smith's comeback is being talked about around the world, described as little short of miraculous. Alan himself says he's living proof the establishment should be taking high-dose vitamin C seriously, and sooner rather than later. And just a short flight away, his launch in Tauranga. You know, Alan, that there will be many health professionals who say that it is not scientifically possible that your recovery is because of having high doses of intravenous vitamin C.
Well, they can say what they like, really, because basically I am alive. I was supposed to be dead. They wanted to turn me off, and here I am, I'm alive.
Well done.
Yeah.
Just a note, Alan Smith no longer shows any signs of having leukemia.
I've beaten the system, as to speak. And, you know, if my family had let them turn me off, I would be dead.
It's not a good day to be dead today.
Not a good day to be dead today. There's obviously a fish out there somewhere with my name on it. We don't catch it.